School committee will come to order, please. School committee will come to order, please. This is a special meeting of the Waltham School Committee. This is a live in-person meeting. Any person present must wear a face mask. 7 o'clock special meeting. Item number 1, rules of order for the school committee members and members of the public in attendance or who wish to speak. And I will be discussing that. And 2, COVID update. So anyone who wishes to record the meeting, please disclose to the chair at this time the recording of the meeting. Okay? Cable's recording? Yes. Okay. Superintendent will call the roll, please.
Thank you. Mrs. Algermal?
Present.
Ms. Donnelly?
Present.
Mr. Frassica?
Present.
Mrs. Gately?
Present.
Mr. Rando?
Present.
Mr. Chirallo?
Present.
Mayor McCarthy?
Present. All rise, please. Mr. Terrell. To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, this is a special meeting of the school committee. It's not a regular meeting, so I'm going to read certain things. Out of our policy manual as well as the state law. Public participation at school committee meetings. All regular and special meetings of the school committee shall be open to the public. Executive session shall be held only as prescribed by the statutes of the Commonwealth of Massachusetts. The school committee desires citizens of the district to attend its meetings so that they may become better acquainted with the operations and the programs of our local public schools. In addition, the committee will like the opportunity to hear the wishes and ideas of the public. In order that all citizens who wish to be heard before the committee have a chance and to ensure the ability of the committee to conduct the district's business in an orderly manner, the following rules and procedures are adopted. 1, at the start of each regularly scheduled school committee meeting, individuals or group representatives will be invited to address the committee. The chairperson shall determine the length of the public participation. Speakers will be allowed 5 minutes to present their material. The presiding chairperson may permit an extension of this time limit. Topics for discussion must be limited to those items listed on the school committee meeting agenda for that evening. Improper conduct and remarks will not be allowed. Defamatory or abusive remarks are always out of order. If a speaker persists in an improper conduct or remarks, the chairperson may terminate that individual's privilege of address. All remarks will be addressed to the chairperson and not individual members or anyone else. Speakers may offer such objective criticism of the school operations and programs as concern them, but in public session, the committee will not hear personal complaints of school personnel nor against any member of the school community. Under most circumstances, administrative channels are the proper means for disposition of legitimate complaints involving staff members. Written comments longer than 5 minutes may be presented to the committee before or after the meeting for the committee members' review and consideration at the appropriate time. Now, the next one is from our policy manual, guidelines for public comment. A school committee meeting is a meeting of a governmental body at which members of the body deliberate over public business. We welcome the attendance of members of the school district community to view your school committee as it conducts its regular business meeting. And this is a special meeting, which is why I'm reading all this. Massachusetts General Laws, Chapter 30A, Section 20F governs public participation at open meetings, covering all public bodies. Chapter 30A, Section 20, notice, remote participation, public participation, and certification. Subsection F, no person shall address a meeting of a public body without permission of the chair, and all persons shall, at the request of the chair, be silent. No person shall disrupt the proceedings of the meeting of a public body. If after clear warning from the chair, a person continues to disrupt the proceedings, the chair may order the person to withdraw from the meeting. And if the person does not withdraw, the chair may authorize a constable or other officer to remove the person from the meeting. The school committee believes that the school district community should have an opportunity to comment to the committee on issues that affect the school district and are within the scope of the committee's responsibilities. Therefore, the committee has set aside a period of time at each school committee meeting to hear from the public. In addition, if the committee believes that an issue requires a dialogue with the school district community, the committee may schedule a separate public hearing on that issue. Any citizen who wishes to make presentation to the school committee on an item which is of interest to him or her and within the scope of the committee's responsibilities may request to be placed on the agenda for a particular meeting. Such request should be in writing and should be received by the superintendent of schools at least 1 week prior to the date of the meeting. Such request should contain background statements which would explain the scope and intent of an agenda item. The chair of the committee works with the superintendent to formulate the meeting agendas. Together, they will determine whether or not to place an item on the agenda, and if the item is to be taken up, they will also determine when to place an item on the agenda and the parameters to be required of the presenter. Here are the general rules for the committee's public comment period. 1, public comment shall be for a period of 15 minutes and shall generally follow the opening of the meeting. The committee reserves the right to rearrange its agenda to accommodate scheduled presenters. 2, any citizen wishing to speak before the committee shall identify themselves by name and address and shall speak for no longer than 5 minutes. No citizen may speak more than once without permission of the chair. All citizens shall speak to the full committee through the chair and shall not address individual members or administrators. Individuals may address topics on the agenda, items specified for public comment, or items within the scope or responsibility of the school committee. The chair shall rule out of order any individual who fails to honor the guidelines or who addresses a matter inappropriate for public comment. 4, any committee member may direct questions to the speaker through the chair in order to clarify the comments of the speaker. Now, I've already read section 30A, chapter 30A, section 20, regarding who can speak and regarding who can, this is regarding who can tape a meeting. After notifying the chair of the public body, any person may make a video or audio recording of an open session of a meeting of a public body, or may transmit the meeting through any medium, subject to reasonable requirements of the chair as to the number, placement, and operation of equipment used, so as not to interfere with the conduct of the meeting. At the beginning of the meeting, the chair shall inform other attendees of any recordings. Okay, now, and the next one is amendment and suspension of the rules. Any rule of the school committee may be suspended at any meeting until the next meeting or for a shorter time by 2/3 vote of all the elected members of the committee, 4 votes in the affirmative, except section 5, which cannot be suspended except by unanimous consent of the committee. These rules may be amended at any time, and we're not dealing with amendments. So, since this is a special meeting and not a regular meeting, and the school committee is not allowed to have public comment at a special meeting, but in light of the subject matter, I would respectfully ask that the school committee suspends its rules to allow public participation under the school committee rules. Is there a motion?
So moved.
Mrs. Algerman moves. Is there a second?
Second.
Mrs. Gately. Is there any discussion on the motion? Mr. Terrell.
Mayor, seeing that this is out of our normal rules that we normally go by, I don't think it's appropriate that we change the rules unless we've given everyone fair notice that they would have the ability to talk. I don't believe our agenda truly gave that notice to everyone that they should be able to talk. So I think we
Okay.
should stay within our normal rules. Also, there appears to be people that are filming and recording the meeting that have not
Is
released their
someone
names.
recording the meeting that hasn't disclosed to the chair? There are 2 people disclosed the recording of the meeting. One lady right here and Cable. Is there anyone else recording the meeting? I'm recording. Okay, over there. Anyone else? I'm sorry, so 4 members, 4 people. Anybody else? 5. Thank you, Mr. Terrell, for bringing that up. Okay, to answer your question, I made sure that the notice of the meeting said, rules of order for school committee members and members of the public and attendants who wish to speak, and that I would go through that.
Okay, I
So
still
that
don't-
was on the official notice.
and I read that notice, and I just didn't think it was clear enough
Okay,
for this to happen.
all right. Would you like to say anything else, Mr. Terrell, at this time?
Not at this time.
Okay. Anyone else have any comment? Okay. I'll take a roll call, please.
Mrs. Aljamal?
Yes.
Ms. Donnelly?
Yes.
Mr. Farasica?
Yes.
Mrs. Gately?
Yes.
Mr. Rando?
Yes.
Mr. Torello?
Yes.
Mayor McCarthy?
Yes. Okay? So now, anyone who wishes to speak, could you please fill out the sheet? And then Mrs. Landry will go and get the sheet, and then I'll call people that are on the sheet. She just has to take down what I said. Yes, anybody else wants to sign up on the sheet? Please do so now. Because I'm going to have Mrs. Landry bring it to me. And then I will recognize each person for no more than 5 minutes. You just have to have order, please.
I don't know if she wants us to do.
Mayor, can I ask a clarifying question?
Sure.
We have many people, it seems, in the audience who are not wearing masks after.
Pardon me, I can't hear you, Mr. Trell.
You have many people in the audience who are not wearing masks after reading.
They're supposed to have a mask on. Unless you have a medical reason, and if you have a medical reason, you can go see the officer.
That's discrimination.
Okay. With all due respect, only one person can talk. The school committee is the only body in the city of Waltham that allows public participation. The city council does not. This rule goes back to the 1980s when, remember, Robert McGurran, God rest his soul, and myself, we put this rule in effect so that members of the public would have the opportunity to address the school committee directly. So I respectfully ask that you honor that request, okay? Thank you. Now, they're going to use this microphone, Doctor?
In the back.
This microphone up here. So as soon as everybody has signed in to be recognized to speak, I will very happily have Mrs. Landry go get that.
Mayor, may I ask a procedural question?
Sure.
In terms of timing, do you want us to be
With the
timing?
15 minutes, you'll have to.
Total.
There's 15 minutes total, so if you can try to keep your comments, succinct, that would be very much appreciated. Because the rule does say 15 minutes. It says 5 minutes, but if there's a lot of people, 15 minutes is the limit. Okay, thank you. Okay, the chair recognizes Sarah McGann for public comment. Sarah, please come forward and use this mic. This one.
In the back.
Yeah, that's one for the staff.
A little better anyway. Hi, I'm Sarah McGann, 109 Thornton Road in Waltham. First, I just would like to say thank you to all of you for all of your hard work. A lot of extra work I know went into just the hell that was the last 15 months, 16 months, and so thank you. We appreciate it. And the second thing I'd like to say is that I support the superintendent's proposal. As the parent of a child who does not yet have the opportunity to get vaccinated, I will feel safer with him in school if everyone has a mask on. Thank you.
Next, the chair will recognize Debbie Coleman.
Hi, my name's Debbie Coleman. I'm at 7 Kenwood Lane in Waltham. I just want to thank you all for taking the time to listen to us speak tonight. I'm in full support of the superintendent's plan to mask every student this school year. I think it's the best way to keep everyone in person learning as well as the community safe as a whole. So thank you, and I hope you guys can do that.
The chair recognizes Max Kresnow.
Thank you. Max Krasnow, 14 Tomlin Street. I am here in full support of the mask mandate policy. COVID is a serious disease. The disease symptoms are not merely limited to the acute stage of the infection. There is a long COVID set of symptoms that is affecting children across the country. And it is unfair to place our children in a position to be exposed to those potentially lifelong consequences. Now, I'm a professor of psychology, and I study the psychology of fairness. And one of the most perverse things about our psychology of fairness is that it incorporates the relative power of the two sides to a contest. We have in this country an outpouring of aggressive action by some of our fellow citizens. That has the consequence of making some of our potentially otherwise rational decision-making influenced by the fear of the consequence that they will face. I encourage the board to go by the science. I encourage the board to go by past precedent. I encourage the board to think of the health of the children.
Okay. Jim Dixon. By the way, all these people are Waltham residents, you know,
Jim Dixon, 32 Lyman Street, Waltham. Thank you for letting me speak tonight. I would like to remind everyone present that we are all under the auspices of the U.S. and the Commonwealth of Massachusetts constitutions. Whether an elected official, school administrator, health official, or union member, no one has the authority to abrogate the inalienable rights of the American citizen. I appreciate the concern for public safety, but at what cost? We are no longer in a state of emergency and shall no longer be ruled by fiat or mandate. We have enough tools available to mitigate the effects of this man-caused pandemic. Even if the number of cases rises, the mortality rate has not increased. There are numerous other protocols that can be utilized without continually infringing on the rights of fellow citizens. I recommend that we explore those courses of actions. We need leaders who will get us out of this panic mode and start governing according to our laws and constitutions.
hey, if I have one more outburst, I'll give you the last warning. And then you will be removed from the meeting. I don't want to do that. We're very fair about letting everybody talk, but you cannot do that. Because if you continue to do that for either side, then you're out of order. Now, next person. Amanda Capone, please.
Amanda Capone, 30 Melody Lane. Thank you for the opportunity to speak today. My name is Amanda Capone, and my family has lived in Waltham for several decades. When my first daughter started kindergarten in the 2021 school year, we were eager to attend Waltham Public Schools. We believe deeply in the public education, in the community it provides, the diverse student body, and the amazing teachers and staff at the schools. She was so proud to meet other children at the local playground who went to MacArthur and was excited to make new friends. We have been following the primary data sources such as CDC statistics and journal articles to guide our decisions this past year and a half. We were surprised last year to hear that schools were mandating masks for children, given that masks are experimental for long periods of time, and since CDC's data have been telling us all along that children have little risk to serious illness, hospitalization, and death from COVID-19. We were told that these efforts were to protect the vulnerable adults at the students' homes, community, and teachers and staff at the school. We wanted to support our community and do our part. It was difficult for our daughter to wear a mask. She complained of not being able to breathe. She wore it improperly, even dangerously, constantly touching her mask, pulling it up and down to facilitate breathing. But we were told by the school that it was a necessary condition to learn. So we complied. The children took on all the risk with this mask experiment for the last school year. What started out as eager excitement to start kindergarten soon became a nightmare. My daughter struggled to pay attention to online classes and became more resistant to going to school as the year progressed to fully in person. By April, she was crying every day before school. She begged us not to send her. She couldn't play with friends, and she told me her friends were fearful of being next to each other. While she and her classmates protected all the adults around her, she suffered anxiety, skin rashes, bacterial throat infection, and finally developed a neurological disorder where she subconsciously touches her mouth for her mask. This is called stimming. She suffered many adverse events during this experimental use of facial coverings, and these are just what we can visually observe. We have no firm understanding yet what hundreds of hours of obstructing her and her classmates' breathing mechanisms has done to bodies' oxygenation and carbon dioxide levels. With vaccines widely available for those vulnerable adults we were protecting last year, along with CDC data around children's low risk to COVID-19 complications, why are you still asking the children to take all the risk in this situation? Children have spent the last year and a half protecting every adult in their community. When are we, the adults, going to take the burden off of them? When do we start protecting the children? Despite our commitment to the Waltham community and firm support in the public school system, we are pulling our daughter out of this massive experiment on the use of face coverings due to the adverse events we have seen her and her friends directly suffer. We are left with no choice but to homeschool this year to provide any hope of getting our daughter's health back and her excitement for learning. I am begging you, consider the risk these measurements have for the students against the risk for the disease itself. Please start caring for the children again. I want to remind you that these measures are experimental, and your decision requires the students' participation in this experiment without true informed consent. Thank you for listening.
Okay. Jessica DeAngelo.
Jessica DeAngelo, 15 High Rock Circle. I am a lifelong resident of Waltham, graduate of Waltham High School and Brandeis University. I'm an attorney licensed to practice in Massachusetts and New York. I took an oath to uphold the Constitution twice. I own a small business here, and I'm a parent to 4 school-aged children. I stand before you tonight to demand that you respect parental rights to determine the medical needs of their own families. This means no mask mandates. For nearly 18 months, I have sat back and watched as a virus with an over 99% survival rate has been used as an excuse for leaders on both sides of the aisle to slowly and steadily chip away at our civil liberties. I can think of no more fundamental right than the right to breathe fresh air. Sure, the right to public education, the right to medical privacy, and parental rights are relevant to this discussion. But if we don't even have the right to breathe, then those other rights don't amount to much. In a world where the COVID goalposts are being constantly moved back and forth, I must remind you that the one thing that has remained constant is that children are not now and have never been the drivers of this virus. Expert reports consistently put the rate of childhood deaths from COVID no higher than 0.08%. There is not a single shred of evidence that any of the measures put in place last year, including masks, could have or actually did influence that number. In fact, it's quite the opposite. Pediatric healthcare facilities across the Commonwealth have been overburdened not with COVID cases, but with children who have been indirectly affected by mandates like the ones we are here to discuss tonight. Childhood mental health issues resulting from social isolation have exploded. Your job as purveyors of education is to ensure that our kids learn the necessary curriculum. It is not to teach our kids that the air is toxic, that their fellow humans are carriers of disease, and that the world is something to be feared. And don't kid yourselves. Forcing something as seemingly benign as masks reinforces those lessons daily. The proposed use of masks in this manner constitutes a medical device. There is not a single person in this room that has the legal authority to mandate that our children be forced to don a medical device as a blanket condition of attendance in public school. School nurses can't even administer Tylenol without parental permission, yet you sit here and think that there's any legitimacy in your attempt to mask our children indefinitely? Let me assure you that there's not. The laws of this state value medical privacy and freedom over personal safety so much that you can't even sue a person with HIV for willfully failing to disclose that fact prior to engaging in a sexual relationship. That's an important point, so I'll reiterate it. The law of this state provides no recourse whatsoever for people who were knowingly deceived by someone who put them at risk for catching HIV, a known deadly virus. That is what you are contending with here. You're worried about the parents who will sue you if their kids get COVID at school, despite the fact that as a practical matter, it would be impossible for anyone to prove how transmission occurred with any legal certainty. And you're ignoring that the laws here are so strongly pro-privacy that we assume the risk of contracting HIV even when we've been falsely but affirmatively assured that there's no risk. Constitutional authority is set up in a hierarchy, and no subordinate level of government can afford fewer rights to its citizens than the level immediately preceding it. The federal government sets the baseline. States can never give fewer rights than that which is guaranteed by the feds, and municipal governments can never give fewer rights than that which is guaranteed by the state. As more and more governance is put upon us, we the people get more and more rights. Governor Baker reiterated just last Thursday that he sees no need for mask mandates. Thus, the state has recognized our right to breathe freely, and the city government cannot curtail that right for any of its citizens without running afoul of long-standing, fundamental constitutional doctrine. There's an absolute dearth of evidence in support of what you're proposing to do. The science doesn't support you, the law doesn't support you, and the statistics don't support you. But most importantly, the silent majority doesn't support you. The public cannot trust leaders who ignore reality, but instead cater to fear-mongering. Your actions can and will be redressed through all legal channels available to us. I therefore respectfully suggest that you think long and hard before trampling on the well-defined rights of the parents of this community, because we are many, we are well-informed, and we are completely fed up. Thank you.
Next person crossed his name out. And the next person after that, I believe, is Ben Silver. Ben Silver.
I'm Ben Silver, 84 Cedar Street, Waltham. I am in support of a mask mandate, and I believe that the comments, the feelings of people who say that it's trampling on freedoms are overblown. I think that it's more important. I don't see this as an issue of personal freedom so much as an issue of public safety. And having to wear a mask, asking people to wear masks in certain environments, like schools especially, is no worse than asking people to wear shirts and shoes when they go into certain places of business. And instead, I think it's very, on a large scale, of the number, if you think about the numbers, there really is a danger of contagion, much more so in a crowded environment like a school. And it has been shown, despite what people are saying, it has been shown that masks are effective in keeping down the level of contagion. And so I feel, I have a son who's going to school, in high school, and he feels very reluctant to be around large crowds of people, many of whom might not be wearing masks. So I think it's very important that we consider public safety and follow procedures for just a limited amount of time to encourage the stopping the spread, which is growing now, stopping the spread of COVID again, which, by the way, has been shown to be spiking in various school districts which have already started schools in places like Georgia and Texas. And the incidence of COVID is suddenly rising again. So I think it's not hard, it's not asking too much for people to wear masks for the next few months at school. Thank you.
Okay. I'd like to have a motion to go beyond the 15 minutes, if I may, at this time.
Second.
All those in favor?
Aye.
All those opposed? The ayes have it. Okay. Next on the list, I think it's Tom Silva. I don't know, is it the first name? I'm sorry to get. Thank you.
Hi, my name is Sam Silver, 84 Cedar Street. I'm the son of the previous speaker. As a fellow member of the school community and as a student in the high school, I'm still not going to claim to speak for other high school students, and I don't think anyone should claim to speak for any other majority, but I do think that we should listen to the facts and that we should listen to the science and the research that has been carried out. I'm in full support of a mask mandate because with the coming of the Delta variant and the paltry vaccination rates in our town compared to the state as a whole, we are in a much different situation than a lot of other places. And this variant has been shown to pose a threat to the long-term health of adults and children alike. This mask, I don't see it as an infringement upon my freedom or a question of my freedom at all. As my dad said, it's just like wearing a shirt or any other sort of simple thing you could be asked to do. There are those that would say that it's my child, my choice. And I would ask you this, is it your child, your choice to let your child bring a gun to school? No, absolutely not, because it's a matter of public safety, not a matter of freedom. It is an infringement upon your freedom, but it's a necessary one to not let your kids bring guns to school. Likewise, but in a less severe sense, it is perfectly justified to ask children or mandate that children take necessary safety precautions to limit the spread of COVID through our community and in the state and the global scale even as a whole. Everyone must do their part to help us get through this. There is extensive research that shows that masks are effective in limiting the spread and the transmission of COVID. There's extensive research that shows that. I don't see how anyone could claim reasonably that it's simply debatable and that we should ignore it. But I think it's perfectly reasonable, and although I'm touched by, I was touched by the woman here that said, that talked about her child's experience with masks and how it hurt her and it was a very, a strong detriment to her health. I think that's terrible, and I think that's something that should be made that provisions should be made for. However, I think anecdotal evidence like that should not be used to make a decision for everybody as a whole. I think we should use the science, the research, and the facts to make that sort of decision and make provisions for exceptions like that. Thank you.
Next on the list, Kelly McAvoy.
Kelly McAvoy, 18 Fuller Street. Good evening. Thank you for providing the opportunity for us to come together tonight. I am a Waltham educator. I am a current Waltham administrator, but I'm speaking to you from my vantage point this summer as the director, the district summer program coordinator for all of Waltham Public Schools. Under the direction of the superintendent and the assistant superintendent of curriculum, I oversee all aspects of the more than 25 total summer programs and standalone classes occurring throughout the city. In spring, the decision was made that updated guidelines for safety and health protocols from the school year would extend into summer programming, including daily monitoring for symptoms, maintaining strong hand hygiene, social distancing, and mask wearing. In 10 weeks, over 1,700 Waltham children in pre-K through grade 12 participated in various in-person programming in 7 of our 10 buildings. We employed close to 300 staff members, including teachers and paraprofessionals, security, nurses, and coordinators. During the summer, we did have numerous students and teachers, vaccinated and unvaccinated, symptomatic and asymptomatic, test positive for COVID-19. As during the school year, a coordinated effort between nurses, teachers, coordinators, the director of nursing, and the Waltham Board of Health occurred in each instance to evaluate the situation and to determine risk factors, close contacts, and much more. Positive cases in the schools were determined to have not been spread through programming in the schools due to the measures that we had in place. Furthermore, because all positive and presumptive positive cases were only in contact with people who were masked in the school, we did not have to make the difficult decision to send home groups of students or to shut down any program. The protocols in place helped our students be in school. At the end of each program, surveys were sent to stakeholders. 96.1% of educators who worked in our programs answered favorably to the statement, "I felt safe with the level of COVID-related safety measures and protocols in place this summer." And 93.2% of families answered similarly. The district's decision to maintain mask wearing this summer mitigated the transmission of the virus within our schools, ensured in-person program experiences for children on the heels of an unpredictable year, and helped to maintain a sense of safety for our students, families, and teachers. Was it ideal? No, but for the time being, it was effective and safe. As I visited programs throughout the summer, all summer, students and adults were engaged, learning, rediscovering the spark of fun and education that had been lost, rebuilding relationships with peers and with teachers and adults in their life, and more importantly, doing it while safe. I did not need to see their smiles to know they were there. Thank you.
Okay. The next on the list, I believe it's Justin. I don't know if it's Casano or Casona.
Your tests are fake. Tests are fake. There's no COVID. COVID is a hoax.
Excuse me, if you speak out again during this meeting, I'm going to ask you to withdraw yourself from the meeting. And if you speak out again, I'll have you removed. Go ahead, sir, you have the floor.
Thank you. My name is Justin Casano, 43 Carlin Road, Waltham. I am against these masks. We're talking cases, not deaths, not hospitalizations, cases going up. That's when everyone's BS meter should go off. We're hyping this up too much again. We're letting the media make everyone run wild. If we were really worried about safety, this is a glorified doily and people are wearing custom-made t-shirt rags. Not respirators, not ND5 masks. If we want to do this, let's do it with real masks. This is foolish. This is either people going along to get along or people that really believe that this nonsense works. This is Chinese mass-produced nonsense. You know, my oldest one just graduated high school, going to college. It's amazing what this does to a children's psyche. She's an 18-year-old girl now, young woman, and she's a mess from this nonsense. My youngest one's in 3rd grade. There was a hyper, off-the-wall, rambunctious kid, and it is a shackle. It is amazing the nonsense that this causes with children. And there's no way to prove this low as cases. How in God's earth would you do a study to say that this, honestly, lowers cases? This is insane that I have to leave work early to come here to talk about this. A t-shirt rag in a doily. That's all I have to say.
Next on the list. Looks like Richard Stout.
Hello. I have two facts. You can draw several conclusions from them.
Are you Richard Stout, sir?
Pardon?
Are you Richard Stout?
I'm a little hard of hearing.
Okay,
Speak
are
up.
you Richard Stout, 26 Wyola Prospect? Just trying to figure out who you are.
I'm Richard Stover, 26 Wyola Prospect.
Stover, I'm sorry, sir.
No
Thank you.
problem.
Richard Stover, I apologize.
Yeah, I also want to thank the school board for opening this session up to the public. I'm frankly a bit surprised to hear some of the positions opposing masks. To me, it seems the least we can do to protect children, people at home, and faculty, especially the teachers. I mean, I would sure appreciate as a teacher, if I was one, which I'm not, but policies that would support my health, because certainly there's a lot of exposure there. So masks work. I think the vast majority of people know that. I really appreciate the information from the summer programs and how successful they were, both that they were successful and that masks were a part of that. That's really encouraging to hear. That's local data that supports what the school district is proposing to do here. So I encourage you to go forward with the pro-mask policy. Thank you.
The next two people crossed out their names.
Excuse me, was one of those 32 Cutter Street?
No. No. Guinan and Graymore. And the other one crossed out, but they didn't put a name. They didn't put an address. The next person, Chris Shifley.
Good evening, Chris Shifley, 55 Thornton Road. First of all, wow, would I like to see this many people at a regular school committee meeting. First, I want to say I fully support the superintendent's decision. Although myself and both my children are fully vaccinated, I personally would like it to be my choice because we followed the rules and protected the community, and I feel like we did our part. But if the rule's in place, we will certainly abide by it. But first of all, masks are not abuse. It's like saying a seatbelt and a bike helmet are abuse. Stop making masks political and stop minimizing what actual abuse is, because I find it personally offensive. Also, I find the snickering and commenting while community members and students are speaking also offensive. That's everybody.
That's enough. That is enough. Everybody has a right to speak at that microphone. That means you have to keep quiet. With all due respect, you don't have a right to speak right now. This person is the only one authorized. Please proceed.
Contradictory what some people have said, teachers and school staff shared the burden by masking all year, all day, every day. Masking is a mitigation strategy, not a medical use per the CDC. I'm a little unclear about, though, what our mitigation strategy is. Last year we had numerous protocols and mitigation strategies in place, and now the study suggests that Delta has a shorter incubation period, 3 to 4 days instead of 5 to 6, and that it may result in higher viral loads, which may explain why it's super transmissible. COVID is not a hoax, and how many kids is it okay to be sick or die before we put proper protocols in place? At what vaccination rate would the students need to be or community so masks won't be required? How are we going to handle lunches? Kids being masked all day and not being masked at lunch seems nonsensical, but I'm not an epidemiologist, a scientist, or a doctor, and I don't see any of those in the audience either. Will vaccination clinic be connected at the high school for students to be vaccinated? How will large class sizes be handled for social distancing? What about classrooms with no windows? What are the plans if we have an outbreak? I'm not saying I'm against any mitigation strategies, I just like to know what they are. Lastly, this is like being assigned to a group project where some of the people do all the work, while all the people receive all the benefit. And now I'm getting angry. That we are still in this place where we have been, and by we I mean this community, and we are stealing children's educational experience by refusing to wear a mask and not getting vaccinated. New variants are forming. My daughter's a senior this year at Waltham High School, and she has spent the last year and almost a half masked or in school virtually because people fail to believe in science or do the right thing. I'm fully vaccinated, and so are both my children, because science. Here's a mitigation strategy announced by the Mayor of New Orleans today. Anyone aged 12 or older must provide proof of vaccine or a negative PCR test within the last 72 hours to do any activities with a higher rate transmission. We all have choices. Choices have consequences. And if we, or you, don't like them or the rules, we can go to private school. Thank you.
Okay, next on the list, Allison Doan. I think it's DOA, Doan or Doa, 11 Wheelock.
Allison Doan, 11 Wheelock Terrace. I support the superintendent's mask mandate. My top priority is to get my son, he was a freshman in high school last year. He was new to the district. He had no chance to make friends last year. I just want him in school, in person. And with the kids that did attend, masks seem to be effective. It's just a little bit longer. Let's just hang in there. I mean, the cases are worse now than they were last year when the decision was made to be remote. I just want to keep kids in school. I want them to have a chance to socialize safely. I support the mask mandate.
Okay. Andrea Cushman.
Andrea Cushman, 17 Alder Street. So I work in healthcare. I work for regional leadership of a healthcare system, so I have the opportunity to look at COVID data on a regular basis and inform regional policy and national policy. And I also see the national numbers for the network that we're in. And this isn't a science experiment. There are schools across the nation that have already opened up, and they've been the guinea pigs. And there's a whole lot of data and information that we have learned from them. So we have a great opportunity here to do the right thing. And I'm going to share some additional information as well. Dr. Emily Smith, again, a scientist that has been distilling all the research that's been coming out and helping explain it so that all of us can digest it and understand it and think about the implications. Delta variant is a game changer for COVID. So you can't compare where we were last time at this point, because now we have Delta. And that's a definite game changer for some of the reasons that people already explained, which is it carries a higher viral load. And that's why people that are vaccinated, they're saying now rethink wearing a mask, because you could be asymptomatic and transmitting the virus. And the hospital, one of the hospital system in my system, already had a cluster outbreak in an inpatient ward. And we've had to do more testing now, and we've had to put back more mask mandates for people entering the rooms and for patients. And it did show, when we went back and looked at that cluster outbreak, it did show that, thank God, the healthcare providers and the patients that were wearing masks did not get COVID. It was a large number of patients, and it was a great way to once again confirm how effective masks are to prevent transmission, as well as testing. So Delta is, and this is Dr. Emily Smith, Delta is worse than the other variants due to the RO being higher, meaning one infected teacher can spread to 6 to 10 others. We know this. This has been studied and this has been documented. She says if you're a school administrator, mayor, judge, etc., please do the right thing for our schools, communities, children, and teachers. Mandate masks. Okay? Inside Medicine article. In Georgia last week, 7 out of every 100,000 children in the state, not per COVID cases, in the state, were hospitalized for COVID-19. That triples the pediatric hospitalization rate than was observed during the worst weeks of the most recent normal flu season. That was the winter of 2019-2020. And that's likely a conservative estimate of hospitalizations for kids. Historically, August is the month with the fewest pediatric deaths for respiratory and infectious illnesses. That's not the case this year because of Delta. Hospitalizations are increasing. That is easily searchable, and you can confirm that, and I can give you any reference information you would like. Pediatric ICUs in Dallas-Fort Worth are full. They have to airlift kids to other states. The thing about pediatric units is that they're pediatric. Healthcare providers are trained for specific, mostly adult. Pediatric requires specialized training. You cannot set up an additional COVID-10 and just throw any healthcare provider there to treat a child. It's not appropriate. It's different medication dosing. It's a completely different story. So having the fact that children are now, the Delta variant is affecting children worse and they're getting hospitalized is a grave concern, especially with the pediatric ICUs filling up, and then you have even less healthcare providers that are capable of providing care. So, I'm part of a leadership team that has to make decisions similar to you. I appreciate the position that you're in. But what does this come down to? What are we looking at? What are we debating here? Are we debating to do the right thing? Are we debating being essentially grossly negligent? Leadership has to make hard decisions based on the information currently available to them. We have a great amount of information available to us. We have unfortunate regions in other parts of the country that are already showing us what our future could look like. We have a great opportunity right now to make sure that doesn't happen here. That doesn't have to be us. I don't know why anybody would want to take the risk of that possibly being us when we see what they're going through. We're in a situation right now in the US where my healthcare system constantly deploys people to other areas to help support their healthcare systems. Now that most states are higher levels of cases, we will no longer be able to support each other's states. That is it. When you cannot send extra help to another state, you are in trouble. This is different than where we were last year. Last year, we didn't have states with cases rising and hospitalizations around the same time frame. It was spread out surges, and it was very isolated. That's not where we're at right now. So the resources for the healthcare systems are very thin. Especially when you start to now have more pediatric cases, that is very alarming, and that's concerning. And you really, why go there when you don't have to? But just wearing a mask. Vaccinations and masks is what's gonna get us out of this. A couple more months of masks versus, I don't know, pediatric hospitalizations and deaths, that's kind of a no-brainer to me. I think, do the right thing, avoid gross negligence. It really, I'm amazed that we're even having to debate this. It's terrifying to me that we even have to debate this public health scenario.
Okay. Now I have Emma has asked, it was crossed out, but she came up and she asked to speak.
Thank you. Hi, my name is Emma Zumas at 32 Cutter Street in Waltham, and I literally moved here 2 weeks ago from North Carolina. And so I want to share a little bit about the other side, right, of what it can look like in a state that is not doing so well with their COVID response. We were in remote school, so I had a kindergartner last year as well. I really feel for you. We were remote until March last year. My family is still local, which is why we moved back. I got to watch everyone here start to rejoin life and like experience some of the normal things. And that's part of why we moved back, because we were coming back to Massachusetts that has a strong healthcare infrastructure and where they believe the science and where folks are building together community to work towards health for everybody, right? And so similarly, I'm a little bit surprised to hear so many views from the other side, I guess, because in my interactions in my day-to-day since moving to Waltham, literally on August 1st, I have been so impressed by everyone's respect of the science and of wearing masks and of making sure that they offer their vaccination status. And so as a newcomer, coming from a place where that is not the norm, thank you all to everybody in Waltham for doing that for the community. Similarly, I have a kid who's not in school yet, but who has a congenital heart defect. And going to what happens when hospitals are overrun and overburdened, kids like my kid, who might need an intervention upcoming, there won't be space for him, there won't be room for him. And what does that do to his health? Because as a community, we're not taking care of each other, right? A rising tide lifts all boats. And if we can all do this together, I feel for everybody, for every parent in this room, for every educator. This has been literally a global pandemic, and we are doing it together, and hopefully we'll come out on the other end together. My other hat is I happen to be in public health. So when we talk about the science and the evidence, it is there, and I don't have remarks prepared. I even crossed my name off. I thought it was an attendance sheet. But in hearing some of the responses from folks in my new community, I wanted to share my belief, my trust in what masking can do, what other mitigation techniques will happen, hopefully when the school reopens, right? Spacing. In our previous, in North Carolina, the kids ate out lunch outside, right, when they could. Again, to have more space, be in open air when you have to take that mask off. I'm happy to be a resource for anybody in the community who has questions. Again, I'm not prepared right now with any numbers or anything, but I'm happy to answer questions. Hopefully I'm not a judgmental person, right? We're all coming at this from our own experiences, but hopefully we come together and move forward. And so I support masking for schools, fingers crossed, in September. And I'd like to hear any other thoughts you all have on mitigation approaches that you're looking forward to implementing. Thank you.
Okay, next on the list, Renee Arena.
Thank you for holding this tonight. First, I want to say that I am anti-mandate. But if you want to wear a mask, go ahead and do it. In 1968 and 69, the Hong Kong flu hit the world. An estimated 1 to 4 million people died. It was extremely contagious. Thousands died in the US, yet we didn't mask. We didn't hide in our homes. People went to work and school. We had Woodstock. And it's still around. It's known as influenza A, I believe, subtype H3N2. Every year, we used to have a flu season, and people died of the flu, and we don't mask. We get flu variants, Asian flu, Spanish flu, swine flu, Hong Kong flu, and we don't mask, and we usually don't fear it. According to an article in Reason.com recently, about 300 Americans under 18 have died from COVID-19. Now, I'm sorry that these kids died, of course, but there are millions of kids out there now that may be at risk from mental health problems in the long run because adults are teaching them to be fearful and not stand up. We may have more COVID suicides in young people than COVID deaths. It is heartbreaking to hear a child say to you that they have to wear a mask in gym and that they had to run with it on and that it was hard to breathe that way. So kids like this have to wear a mask because adults are afraid. But I would also like to say that I've been a teacher's aide, and I've been a Sunday school teacher, and I remember how germy classrooms can get. Still, we need to stop looking at each other and children as disease vectors. COVID will likely be with us for decades to come. Parents, the time has come to take a stand and say no to mandates. They are not laws. Who is the CDC? They're unelected bureaucrats. Who's the Board of Elementary and Special and Secondary Education? Again, they're unelected bureaucrats. Who's Fauci? He's not God. It is time to realize that you are the expert on your own child, that you have the God-given right or responsibility to say, no, stop this madness. It will not be easy. But the time to do this is now. The Department of Education can only have power over us if we let them. So I ask you to please get up, turn the TV off, and do some alternative research. Read the Great Barrington Declaration. Check out America's Frontline Doctors. Look at videos by Dr. Peter McCullough, or from a channel called the Academy of Ideas, that has a video that's called, that they recently put out called, An Obsession with Safety Creates Sick Minds and a Sick Society. Read Brave New World by Aldous Huxley and 1984 by George Orwell. Stop listening to what you're being told. Start telling our elected officials what you want them to do. And the school committee, you have the chance to do something big here. You have the chance to say this stops now. So we stop letting fear rule over us. Fear of a virus with a, 98% survival rate? If I can do this, if I can say this in Massachusetts, anyone can stand up. I hope you do the right thing and leave things up to the people who are experts on their kids, the parents. Thank you.
Next, Annette Reynolds.
Good evening, and thank you so much for this opportunity. I found out about the meeting yesterday, so I didn't come with prepared remarks. I'm talking off the top of my head, which can be fairly dangerous. I've been telling my friends that I've been getting most of my exercise lately by shaking my head. I cannot believe that we have not educated so many people to learn how to look at the numbers, to look at the data, and to make decisions that keep them safe. Many of you know me here in Waltham, the groups I've been involved in. You may not know that I have 1 degree in chemistry, an advanced degree in biochemistry. I used to be the Millipore man at NIH at one time. My husband has a PhD in biochemistry, a postdoc from Columbia, another postdoc from Hopkins. My oldest son has a PhD in environmental biochemistry and a postdoc from where I can't remember. My second son is a physician. Dinner at my house is like living in the Big Bang Theory. It's science, it's facts, it's numbers. The numbers are clear. The facts are clear. Those who want to dispute them, I'm shaking my head again. I strongly urge the school committee to pass the superintendent's plan. It's common sense. And when we look at the numbers, 2% mortality rate. That means a couple of you would be dead, just the people in this room. And while it's 98% for most of us to be surviving, for the 2 who die, it's 100% for them. My daughter-in-law is recovering from COVID, fully vaccinated. She thinks she got it from her daughter, 7 years old, who can't be vaccinated. If you don't think that put the fear of God into me, it really did. It may not have come close to you at your home. It came close to me. I know too many people who've gotten sick from this horrible disease and have died. And I'm unwilling to allow that risk to increase for the children of Waltham. I strongly urge you to support the superintendent's plan.
Next on the list, Michelle Devane.
Hi, I'm Michelle Devane, 32 Milton Street. As parents, we protect our children, which is why I stand up here tonight. I'm a mother of 3 young children, ages 8, 5, and 3.5. I strongly oppose this mask mandate. I believe that muzzling a child with a sweaty, dirty, spit-soaked rag for 8 hours a day harms their social, emotional well-being and is psychologically damaging. I believe that teaching them that the air around them is toxic and that their family and friends could get them sick, and depriving them the ability to see their friends' faces and smiles has a lot of damages to them. And what about all the things developmentally, when they can't read facial cues, or watch a teacher enunciate words and letter sounds like my middle son will need to do as he enters kindergarten in September. And the biggest question is what happens to a child's immune system when it's cut off from doing its job. Because along with masks comes social distancing, and children are social creatures by nature. They crave physical closeness and are now forced to stay away from each other. My daughter would come home upset last year from school because she was no longer allowed to play certain games at recess, because those games enabled children to be too close, the teachers would say. 4.2 million children have tested positive for COVID. 0.08% have died from this. In 2018 and 2019, 480 children died from the flu. That's more than COVID in a year and a half. But not one doctor, CDC health official, or parent has ever asked for masks to be worn. Not one ever. Many of the people asking for the mask mandates don't even have children or don't wear masks themselves, which is complete hypocrisy and a political scam as far as I can see it. Forcing children to be masked is cruel and a form of child abuse in my eyes. Thank you.
The next person, Bobby, asked not to speak. Then we have Meg Silva.
Hello, I'm Meg Silver, 84 Cedar Street, Waltham. Mayor McCarthy, Dr. Reagan, School Committee, thank you very much for having this chance for a dialogue. I'm speaking in favor of mask mandates. Very easy, simple method to save lives. And we've lost a family member to COVID. We've had too many friends and family members sick from it. My son who spoke earlier, he's a student here. He needs to be safe, along with his classmates and teachers. Right now, children from 0 to 11 have 0 vaccination. And our high school and middle school kids are not fully vaccinated. This is a can of worms. We need to protect our students, teachers, and all of their staff people in our pro school. And I am personally offended by people who say this mask is child abuse. I'm a victim of child abuse. This mask is nothing. This mask is nothing like child abuse. If you want to say it's child abuse, live my childhood, and that you'll know the difference. Please protect our children and staff. And also please look at lunchtime, especially at the high school, 300 to 400 kids eating lunch with no mask worries me, and full buses with nobody to monitor the mask wearing worries me. Thank you very much.
Who spoke? Who spoke? Me. Could you withdraw, please? I just allowed you to speak. Could you withdraw or behave yourself? This is a process. Everybody has a right to express their opinion. Everybody. But when you interrupt, you're interrupting.
You won't want to abuse children.
Okay. Are you going to stop, please? Are you going to stop, or I'm asking you to withdraw yourself from the meeting? I want you to either stop or withdraw yourself from the meeting.
I'm asking all of you to stop forcing abuse on children.
Okay.
Why does there need to be
Officer,
a mandate? I agree.
Officer, I've asked you repeatedly. I've asked you repeatedly to respect the process and the right of everyone to speak.
What are you all wearing masks for if you're against mask wearing?
Okay. With all due respect, officer, please remove.
I came here to advocate for you guys, and you guys show up in masks.
With all due respect, Mr. Vane, right?
And everybody's going to say it.
Mr. Vane, is that you speaking?
You're all going to say it, right? Yeah. This is what we do. You're welcome. You're welcome for coming all the way out here to advocate for you, Renee, and you, Amanda. You're welcome. God bless America. God bless America. Constitution.
I couldn't see who it was. Who's this? I'm sorry. Yeah, I apologize. It wasn't, I don't know who that one is. I apologize to you. Okay, next on the list, Jonathan Lamatanya. Please clear the corridor, officer. Hold on for a minute. Please clear the corridor.
My name is Jonathan Lamontagne. I'm
One
from.
minute, Jonathan. You can't close the doors. Chrissy, you can't close the door. Excuse me, Mr. Bressler. Tell the officer.
And you all should be ashamed of yourself.
Clear the corridor, please. Clear the corridor, thank you. Jonathan, you may proceed.
I live at 1369 Trapello Road.
Hold on. Officer, with all due respect, have them move down. This is a public meeting and everybody has a right to speak. Okay, now we can hear you, sir. You may proceed.
My name is Jonathan. I live at 1369 Trapello Road. I'm a professor. I study risk analysis and decision-making, trade-offs. I appreciate that life is a trade-off and that there are risks. We take risks every day. And I'm very sympathetic to many of the stories that have been told on both sides of the argument. I will say my son is in pre-K now, and multiple COVID-positive kids have come into his class, and there are masks in class, and there has been no transmission within the class. Now, I know that that's an anecdote, but still, it speaks to the effectiveness of masks. As I said, I am sympathetic to the stories that have been told. I understand that it is difficult for kids, and nobody likes this. I don't think it's going to go on for much longer, and I know that that's a hard thing to accept or believe because we felt like that before. All this being said, I'm in support of the mask mandate, and I urge the school committee to vote in favor of the proposal. And the last thing I'll say is just I wish that folks would show more sympathy to other people speaking. Making comments when a high school student is speaking to his own personal experience, even if you don't like what someone is saying, I really think the other person should be allowed to say that. That's all.
Next, Tom Haley.
Hi, my name is Tom Haley. I'm from 122 Florence Road. I'm here to support the mask mandate. My wife and I have 3 children, 1 who's old enough to be vaccinated, 2 who are not old enough to be vaccinated. That's really our biggest fear right now, is thinking that they're going to go back to school, especially our youngest, who will be in elementary school with 100% of the kids unvaccinated and at full capacity. I'd like to echo some of the things that were just said. I do empathize with a lot of people on both sides, especially you, ma'am, if your daughter had such a time. I would hope that there's a way that provisions can be made so that she does not have such a tough time with it. But when I hear people start making comparisons to infringing on their constitutional rights or civil liberties, I think that's a little bit over the top. To say that wearing a mask is really that hard, I think, is just being a little bit overdramatic. I also think that someone made the comment about, well, if you don't want to wear a mask, if you want to wear a mask, go ahead and wear one, which I think is perfect logic if it doesn't affect the person next to you, but it does. So for the same reason that we don't let people smoke in schools, why would we not just say you have to wear a mask? It doesn't affect just you or just your kid, it affects everyone around them. And lastly, the idea of just barking out, it's a hoax, or to the folks who were just escorted out, who were making comments and snickering almost every time somebody said something they didn't like, I think it doesn't do anything to help your cause. I think it actually makes you look childish, and I think it really makes you look like you're not a grown-up and can't help come to a conclusion where we can all come together and hopefully, even though we might disagree, respect each other's opinions. So thank you again. Thank you, committee, for allowing us to speak, and thank you for giving me a chance.
Okay. Next on the list, Kathy Snyder.
My name is Kathy Snyder, and like one of the previous speakers, I just found out about this meeting, so I don't have much to say, and I think I'm the last person on the list because I decided to speak because I can't keep quiet, you know that. I don't think there's really a point that has been made that I can see both sides of. However, I'm not a scientist. I'm not a lawyer. I don't know anything about constitutional law except what I learned in school. Not a scientist, but I believe in science. I am a nurse, retired nurse. But I worked in ICUs, I've worked in emergency rooms, and most recently at Children's Hospital. I want to know if any of you in this room, have you ever seen a kid struggle to breathe, ever? And I'm sure if you have, it's a sight that you will never forget. And for me to stand here and have this discussion about something as simple as a mask that could prevent that, why are we even here? Why are we even here having a discussion about this? Let's talk about why we don't test the kids before they go to school, why we're sending 400 kids into a classroom that haven't been tested for COVID. But basically, to have something as simple as a mask be within your power to save children, please do.
Okay, next on the list, David Kane.
There was a pandemic in 1968. The public called it the Hong Kong flu. The CDC had a letter number combination for it. It killed 100,000 Americans and 1 million people all around the world. Those numbers come from a page on the CDC website. And yet, 3 months after the CDC saw and documented the existence of a pandemic, Super Bowl number 3 was held with a full stadium of fans. Masks were not required in 1968 or 69 or 70 or any other year. They're not required now.
Okay. Now, that's the end of the list. Is there anyone that didn't sign up that hasn't spoke that likes to speak before I ask that the public comment be closed? So, put your name and address, please.
Oh, sure.
And I know you came in a little late.
Yeah, I apologize.
Okay, the chair recognizes Sandra Bartone.
Bartone, sorry, poor handwriting, last minute. Similar to others who have spoken, I'm here in support of the mask mandate. Sandy Kalick, Bartone, 27 Livingstone Lane. I missed that part, I apologize. I found out about this meeting somewhat last minute, so I'm not here with prepared remarks, but I will simply echo that it doesn't cost us anything. Like, there are children that have a harder time with it. My 3-year-old was not super thrilled. He's now 4 when he had to wear a mask to see any of his friends last March. But he's been doing it for a year and a half now, and he's gotten better. And now he can be around other people and wear a mask, and he feels comfortable. It doesn't cost anything at all.
It's child abuse that costs abusing on the children. They can't breathe with the masks.
Sir, you heard the rules from the very beginning. You cannot speak out and interrupt a speaker. Please don't do it, or else I'll ask you to withdraw. Would you like to withdraw from the meeting, sir?
It's tyranny and...
Would you like to withdraw yourself from the meeting?
I'll leave the meeting, yeah.
You don't have to leave the meeting if you're not going to interrupt another speaker. Okay? Very good. Thank you. Proceed, please.
Thank you. Last year, we had Waltham School Online. We had options as parents to make the best choice for our children.
Last year, we were able to choose online or virtual, in person if we wanted to go that route. And of course, there were remote weeks and in-person weeks and all of these challenges that had to be managed. But this year, we don't have any choice. We have to either be in person or pull our kid out of school. So unless suddenly we're going to be able to have online school as an option for parents that don't feel comfortable sending their children into the building with a full school of children, this is the safest thing we can do for our kids. It is the easiest and safest thing we can do for our kids, unless we're going to suddenly open other buildings to teach them and spread them out a little more. It's so simple, and it works. We have a public health professional that says so.
Okay.
Thank you.
Okay, I would like to thank everyone for their public participation. I thank all of you who have been respectful to the process and respect the right of people to get up and say their opinion, and I want to thank the school committee for that. So at this point, I'd like to have a motion to close public participation.
So moved.
Second.
All those in favor?
Aye.
All those opposed? The ayes have it. Now, we will pursue to item number 2, COVID update, and the chair recognizes the superintendent of schools.
Thank you, Mayor. As the committee knows, I submitted this memo to you in preparation for our meeting last Wednesday. And in that memo, I am recommending a district-wide mask mandate for staff and students. Some of the things in the memo have shifted slightly since I put it together. Every week, the state provides additional data around COVID. It's good to see that our numbers are going up in terms of people that are becoming vaccinated. So I just want to note from the memo, I had 59% of 12 to 15-year-olds reported by the state as fully vaccinated in Waltham. That number in the August 12th state report was up to 63%. The percentage of high school students, 16 to 19, I reported at 33%. That still remains very low. That's only going up to 34% in the week. So I just note that so that for the record, the memo, which has not been updated, you know that those two figures have been updated. As it states in the memo, the reason I make this recommendation first and foremost is because I want students to be in school. And we can remember all of last year where we struggled to get us to a point where we had classrooms full again. And quite frankly, it wasn't until the state mandated that we were able to pull that off. And that took us till March for elementary, and April for middle, and May for high, roughly. And I don't want to find ourselves in that position again. A couple of things that were mentioned tonight that I would want to point out as sort of aligning with this theory is if you look at what's happened this summer, we made that deliberate decision to keep masks on students, and we did not see spread within the summer program. We made that decision because last year we had 374 cases that were related to people within the schools, meaning they were positive teachers, positive students. Out of those 374 to 76, I don't remember the exact number, we had 3 instances where we could tie it to a school-based spread. 3. And those instances of school-based spread involved people not following the mask mandate, mask protocol, excuse me. In all the other instances where we had people in the school who were diagnosed as positive or came to school that way, we had no other instances of spread within the school, which is really at the heart of the issue for me. We want to keep schools open, then we need to keep spread down. We need to do everything we can to make sure that there is no transmission in school. Is it perfect? No, it's not. I can't guarantee that 2 kids sitting next to each other wearing a mask wouldn't transmit the virus to each other, but I can tell you based on our own facts and our own data that the mask mitigation seems to work. And the other piece that was brought up, and I think it was tied back to Ms. McAvoy's comment about summer school, we didn't have to shut down programs. We didn't have to send large groups of kids home. The state has updated its quarantining guidelines. It's bolstered its testing programming. And I think all of those things together, along with a mask mandate, we'll do, again, what I think we all prioritize, which is keeping students in class with their peers and teachers, albeit with masks, and I know that's not ideal, in the hopes that we see the numbers move in the right direction, and then we can pull those masks back. The other thing I just want to note before you hopefully take a vote on this tonight, we all know that if you're under 12, you don't have the option to be vaccinated. And because there are so many students, that's about half of our population, doesn't even have the option to vaccinate. And because of that, I think we're obligated to make sure that we go to the lowest common denominator of safety and make sure that those kids that don't have the choice, and in addition to that, many of them don't have the choice to learn anywhere else but the Waltham Public Schools. If they don't have the privilege to go to a private school or to be homeschooled, we're the only game in town. And I feel that it's our obligation to make sure that every one of our classrooms is as safe as possible. There are a lot of questions tonight about the other things. We're going to be masked, but what happens at lunch? What other mitigation strategies are in place? The state has given us very little guidance on that. As a matter of fact, it's sort of a free-for-all if you come at it from the Department of Education and DPH. We are putting together an updated reopening plan. Folks from last year will recall we had a pretty significant plan that had all of our mitigation strategies in that. That is being updated as we speak, and that will be shared with the committee and with the public. The reason we haven't pulled together an 80-member committee like we did last year is because the reality is the mitigations are already there. We already know what to do in these circumstances. It's just a matter of now how do we put those puzzle pieces in place. So that is coming. There is a forum scheduled that it'll actually go out hopefully tomorrow. We have a letter for families. I was waiting until your vote tonight to send something out to families. We will have a virtual forum for families on the 24th of August that will be streamed live, and it will be in multiple languages, so we can review that master plan with folks again, so we can tell them what the plans are for lunch, which is a really legitimate question. The simple answer is we will distance as much as we can, we will use outdoors whenever we can, and we will have them put their mask back on as soon as they can when they're done eating. But we know that that's a time that a lot of parents are worried about, and I don't blame them. I have a child in school myself, and I think about that every day. So please know that that is coming, and that has a lot more details. It'll talk about the updated quarantine protocols from the state that literally just came out last week. It will talk about our approach to COVID testing next year. It will talk about extracurriculars. It will talk about even have information on how we intend to spend the federal dollars that are coming in through the third round of federal funding. There is a process for that as well that will involve some public input, but we'll have the first round of information out for families to see that this is how we are thinking about spending the $5.3 million in additional funding. And then come in September, we'll have an opportunity for parents to weigh in on that and give us feedback more formally, but this will be a draft of that. So this will be a pretty comprehensive document. It'll look very much like the one that we formatted last year. There's a section on instructional approach. There's a section on social emotional learning, just the strategies that we will focus on employing as we open schools in the fall. So I know you know my position on that. People in the audience know my position on that. On masks, it has not changed. I would ask that I have your support tonight in voting for that mask mandate, and then I will inform the broader community of that as early as tomorrow.
So moved. Mr. Terrello, I'll recognize you first.
Make a motion to support the superintendent's proposal and implement a full mask mandate in schools.
Second. Full mask mandate for the schools. There's a second by Ms. Donnelly. Any discussion? Mrs. Gately.
I just want to thank all of you who came today for coming to let us hear how you feel about the mask mandate. But I want to especially thank Dr. Regan for the work he's done and for the plans that he's made. in my opinion, as a former teacher and administrator in the system, I want our kids in school. And right now, masks are going to make that happen much better than if they don't. So thank you, Dr. Regan, but thank you all too for letting us hear how you feel.
Ms. Donnelly?
Yes, I would like to add that I think we all got many, many, many emails, and a lot of the people wouldn't be here because there were probably close to 200 emails that we received. And I read every one of them, and I tried to answer everyone, so I think maybe one or two didn't get answered, and the others I gave 2 answers to. But they were all rational. I was surprised that there were only 2 opposed of the ones that I haven't even had time to count them because they were still coming in when I left to go here. So aside from that, we saw it work very well last year, and there was cooperation and there was learning, but it was shouldered by the superintendent, the administrative team that he put together, and there was a lot of cooperation among the staff. And so I would like to see that happen again too, and maybe we can get through this quicker.
Okay. Anyone else want to be heard? Okay, I'll ask for a roll call, please.
Want me to call the roll, Mayor?
Please, yep.
Mrs. Algermal?
Yes.
Ms. Donnelly?
Yes.
Mr. Frastica? Yes. Mrs. Gately?
Yes.
Mr. Rando?
Yes.
Mr. Tarallo?
Yes.
Mayor McCarthy?
Yes. Okay, so,
Motion.
Mr. Tarallo?
I'd like to make a motion to have the school committee subcommittee policy come together and make and formally write a policy for this next coming school year as soon as possible, and then bring it back to the committee to vote on.
Okay, that's not on the agenda, but the update is. But I'm going to say this for the record. If you wish to have a policy change at this point, you know what the process is, Mr. Tarallo.
Okay.
Okay? So at a regular meeting, you have to bring that up, you know what I mean, put it on an agenda, and then it has to be referred to the committee of which you're the chair, correct?
Yep.
And then it has to have 2 readings, correct?
Yep.
And then final adoption. So respectfully, I will ask that you do that at, you know, the earliest possible time you can have a meeting for that, okay?
We'll do that.
Yeah. All right? Anybody else on COVID update? Okay, I'll entertain a motion to adjourn then.
So moved.
Second.
All those in favor?
Aye.
All those opposed, the ayes have it. Thank you very much.